Welcome back. Now, the Gauteng Economic Development and Finance MEC, Lebogang Maile, has said that the province could find itself in a 6 billion rand recline by by June of this year. Maile pointed out that the Health Department is the biggest financial strain to the provincial budget, citing persistent non-compliance with supply chain regulations and corruption. Answering questions in the legislature last year, Health MEC Nomantungo Moralehoko revealed that the department owes 69 suppliers about 743 million rand for over a year. Let's get some perspective now from Parliament's Portfolio Committee on Health member, Dr. Kgosi Letlape. Dr. Letlape, thank you so much for the time. Really appreciate it. What is going on with the Health Department in Gauteng?
The Health Department in Gauteng can't be managed by those that are expected to manage it. It should be put under administration. The management is totally incompetent. And as the MEC has said, there's a lot of corruption. Supply chain procedures don't work. The human resources procurement don't work. Nothing works in Gauteng. And it needs to be put under administration. Management is incompetent. Human resources are not right-sized. We cannot maintain equipment. People living with cancers can't get appropriate treatment from our institutions. This institution needs to be put under administration. This is what we've been saying to the Minister of Health in Parliament.
That's a wholesale change, sir, that you've proposed and put forward. Surely it hasn't been widespread like that. And if so, how long has that been the case and why has nothing been done, do you feel?
Oh, it's been there for a long time. Remember during COVID when we had patients that starved in hospital in Tembisa. Remember Babita Diokara, who highlighted challenges in procurement and was then assassinated. Nothing has come out of that. No managers have accounted. Nobody in procurement has been fired. And that is a problem with the way we are procuring from people that don't know anything about what they are supposed to supply. We should be getting our supplies from original equipment manufacturers. We should professionalize the service. You shouldn't have people that have no skills, business skills or health skills running our health system.
Putting it under administration, why is nobody willing to do that?
Because I guess it's eating trap. Remember, when you have all these forms of corruption, there seems to be benefits to parties under control and to officials that are under control. So unless somebody does something, nothing's going to happen. And one of the key issues is that those of us that are public officers don't use public facilities. And as long as that is the case, nobody cares whether it works or not. Until you get to a point where those that work in the public healthcare system and all public officers, including myself as a member of parliament, are compelled to use public services, our public services will never come right.
But if we are in a year in which we're hosting the G20 summit and Gauteng's own health infrastructure is at odds with even working at all, as you put it, sir, and that it should go then under administration, we're not anywhere near being, one, a world-class city in Johannesburg, a world-class province at all in Gauteng, and the economic hub, ultimately, of this country is failing. Is that what we're saying?
Well, remember that South Africa has two nations. One that depends on the public sector and one that depends on the private sector. Our private sector compares to some of the best healthcare systems in the world. So when those G20 officials come into the country, they will have access to the private healthcare system, which can compete with any healthcare system elsewhere. They are not going to be using public services. So issues like G20 are postage stamp things. They are not going to help us with our developmental agenda. As long as we have two separate countries, where being public means you are poor. And if you have means, it means you are private. Even if you're a government official, this country will not work. Until this country becomes one nation, under God, with one health system that serves all citizens, where the president is the first person to use our public healthcare system, nothing will ever come back.
So do you believe then that Gauteng will certainly be going under administration or at least be bankrupt then by the middle of this year?
Remember that the people that are in there, a lot of them have been put there by the parties in power. They've been there for a long time. They are inappropriate. They don't know what they're doing. You wouldn't ask them to manage a spaza shop left by your grandmother. They would never find a job in the private sector. And that is the problem. Until we professionalize that service, until we ensure that those that are employed to work there full-time, do not masquerade elsewhere, that they would also be prepared to have their own healthcare from where they dish out health services, nothing will ever come good. With the separateness, we are not going to see the end of the day. There's corruption, there's lawlessness, there's inability to prosecute, you have an inefficient judicial system. It's all a nightmare. And unless we have skin in the game as officials, as policemen, we don't have POLMED to go private. As lawmakers, we don't have PARMED to go private. Then we will never, ever sort those problems out. We've got to make the public healthcare system work, and we've got to ensure that we get our own services from it. That's the only way we stamp out corruption, when our lives are on the line.
So ultimately, it's a change in ruling, saying that every public official ultimately would need to be using public services, one. And then two, stamping out corruption by way of ensuring that there's a lot more oversight. Is that not your job then as well, as part of the Portfolio Committee on Health, to be part of that oversight? Is that lacking as well?
That is lacking as well. When you try and do individual oversight, you are blocked from accessing facilities. So remember that issue really doesn't work. So what we need to do is to professionalize public service. What we need to do is to insource, stop outsourcing security, stop outsourcing basic things that you can do. What we need to do is to stop overpaying for overpriced merchandise. With the buying power, buying for 40+ million people, you should be getting the best prices on anything. All equipment should be sourced from original equipment manufacturers. If we want goods, you can't have someone that runs a car wash being the one that's supplying you protective personal equipment. That's just not going to work. So there are basic things that we need to put right. We need to insource. We need to rebuild the public healthcare system. We need to professionalize it. We need to pay professionals adequately. We need to have necessary human resources in the public healthcare system. There are many people that if you lost them today, it would make no difference because they are not essential in that healthcare system. We grow in wrong paths. We need to right-size our human resources and professionalize them. We need to give authority to hospitals to manage their budgets. They need to have maintenance departments in hospitals. Officials should be held accountable. You don't pay your accounts, you should go to prison because it's not your money. It's not your money. What you're doing is destroying services to vulnerable people. So we should hold officials accountable. We should ensure that there is no political interference in appointment of civil servants.
Well,
get the Public Service Commission to work and let them be responsible for apolitical public servants that will serve all and not serve the coffers of political parties.
Dr. Letlape, I don't think these are the words that should only be used for the health department in Gauteng. One could use the exact same words wholesale across many departments in South Africa. I appreciate your time this morning. I certainly hope, as the Portfolio Committee member on health, that you'll be able to at least be as stern as you have been in this interview to Parliament as well, because that will ultimately be needed, and it's the only way to get things forward. Dr. Kgosi Letlape, thank you so much for your time this morning, Portfolio Health Committee member in Parliament.